Hello everyone, welcome to ManpreetRN Talks. So, if you are struggling with your nursing exam questions like NORCET, NCLEX or CBT, don't worry, you are at the right place. So, where we are practicing smart questions, learn fast and move one step closer to your passing NCLEX, NORCET or CBT exam. So today we are going to learn one very important and frequently asked exam topic, that is the barium swallow test. So what is barium swallow test? It is the test of upper GI tract study. So barium swallow test is a diagnostic X-ray test that is used to examine our upper GI tract after the patient drinks a contrast that is called barium sulfate. So basically it is done under fluoroscopy. It helps in visualization of esophagus, stomach, and duodenum. So, why this test is done? That is very important. So, it usually a test done to diagnose esophageal problems such as dysphagia, esophageal stricture, or esophageal tumor, gastroesophageal reflux disease, and some stomach or duodenum problems such as peptic ulcer, gastric cancer, hiatal hernia, any obstructions. So next is how test is done. So basically patient drinks chalky white liquid that is barium sulfate, and after that X-ray images that are taken while patient is swallowing, and barium basically coats the GI lining, so makes the organ more visible on the X-ray. So now more important, that is our duty, nursing responsibilities. So before procedure, patient should be NPO, nil per oral, at least 4 to 6 hours prior to the test. And explain the procedure to the patient that the drink chalky liquid, barium sulfate, and after that this X-ray is taken. And always check the pregnancy test, that is also important. And after procedure, that is very important. A laxative may be prescribed because and always encourage the client to drink more liquid intake so that the barium can easily pass from the stools because barium can cause constipation and it can obstruct the GI tract. So it is important, must encourage the patient to drink more fluids and always prescribe laxative. And always ask the patient to monitor stools for passage of barium, like stool will be appear gray or chalky white for first 24 to 72 hours after the procedure because barium can cause a bowel obstruction. So if there is no bowel movement or any severe constipation or severe abdominal pain, then patient it should be report immediately to the healthcare provider. So always remember nurses, after barium swallow test, the most important nursing action is to encourage the fluid to prevent constipation. So question like this very important in the NCLEX or NORCET or CBT exam. So practice daily with Manpreet RN Talks and move one step closer to your success. Thank you. And if you like this video, kindly share it with your friends and do subscribe my channel.